Thanks for joining me for the second part of my top 10 tips for preparing for pregnancy. Let's continue with tip number 3, optimising all pre-existing medical conditions. A number of women have underlying medical conditions that can significantly impact fertility and also increase complications for mother and baby, both during pregnancy and the postnatal period. This includes conditions such as diabetes, thyroid disease, lupus, kidney disease, epilepsy, asthma, and high blood pressure. For each of these conditions, the better it is controlled prior to pregnancy, the less likely it is that it will deteriorate during pregnancy. Optimal control also often reduces the risk of pregnancy complications such as preeclampsia, fetal growth restriction, preterm birth, and stillbirth. It's my job as an obstetrician to help you to manage each of your pre-existing medical conditions so that your pregnancy runs as smoothly as possible from both maternal and fetal perspectives. Sometimes, in order to achieve this, I need to engage the expertise of other specialists such as endocrinologists, haematologists, or kidney specialists. I'm lucky to work with some wonderful colleagues in each of these fields who have a particular interest in caring for women during pregnancy, and I can initiate referrals to them prior to pregnancy where indicated. Moving on to tip 4. It is vital to review medications to ensure they are safe in pregnancy. Some medications that you may be taking can affect the developing fetus. The stage during which the early layers of the embryo form into the major organs of the body, called organogenesis, occurs as early as 4 weeks gestation. This is essentially the time at which you miss your period. It is only after this point that many women learn of a positive pregnancy test, by which time certain medications may already have affected your developing baby. It is therefore vital that harmful medications are stopped in the preconception period to ensure they are no longer in your system during the early stages of fetal development. In Australia, we categorise medications according to available safety data. They range from Category A, that is medications that have been taken by a large number of pregnant women without any proven increase in the risk of birth defects, through to Category X, which refers to drugs that have a high risk of birth defects and should not be used during pregnancy. It is essential for those of you that use any long-term medications to meet with an obstetrician prior to trying to conceive to ensure that any unsafe medications are ceased and ideally switched to drugs that are safe in pregnancy. For some women, medications with potentially harmful effects need to be continued if the risks of stopping them outweigh the benefits, but this decision should always be made in consultation with your doctor. Let's now address tip number 5, that is reviewing and optimising mental health. This is especially pertinent of late, where COVID-19 related isolation and stress have caused an increase in the number of people experiencing mental health issues. Anxiety and depression are incredibly common in our community at the best of times. For many, trying to conceive, pregnancy, and the postpartum period can be particularly stressful and anxiety-provoking times, with a roller coaster of emotions experienced by many women and couples at different stages. Whilst women with pre-existing mental health issues are especially vulnerable, it is normal for anxiety to manifest for the first time whilst trying to conceive or during pregnancy. Ideally, mental health concerns should be identified and treated pre-pregnancy. Research shows that women with a clear, active management plan in place, along with appropriate support networks, will have greater success in coping with pregnancy and bonding with their newborn. Use of medications such as antidepressants must be reviewed carefully. There are benefits to the mother that must be weighed against the potential side effects to the fetus. For some women, continuation of these medications is vital. Others will wean off medication under the supervision of a doctor prior to pregnancy. The decision to continue or discontinue psychiatric medications must be made in consultation with an obstetrician and mental health professional. Importantly, counselling and psychotherapy often provide an excellent alternative or adjunct to medications. Your obstetrician should be able to liaise with the appropriate people to ensure holistic care is provided.